Okay, hello everyone. Hope you're doing all well. Do you have my voice and is it clear? You can tell me and or you can write in the chat box. Thank you, Dr. Nordquist. So I'm Ali Wahdati, third year pharmacy student, PharmD candidate at School of Pharmacy, Tehran University of Medical Sciences. And here I'm on behalf of the Student Engagement Office of Educational Development Office at TUMS. Uh, I'm happy to be here. We have a different webinar from other sessions that we uh, prepared and designed and went. So in this type, we're gonna have mostly students and their experiences. We're gonna talk about those things. And I hope you're all doing well, staying positive during this difficult times of pandemic, and also testing negative. And I'm just gonna show you the poster. Let me start sharing my screen, and I'm gonna tell you about what will go on today. Okay. So this is the poster of today's session. I think you have been seeing this before. Before talking about our guests and speakers, I just wanted to mention two rules, 2 points I can say. First of all, as we have lots of Iranian audience here, if it is possible for you, please don't write in Farsi in chat box, write in English, any question, any comment, any technical problem you want to mention. And as we are streaming online on Facebook, please do not open your webcam. Okay, so this is the poster. I'm gonna tell you what's will go on today in our session. So we're gonna talk about learning environment in COVID era from students' point of view. First of all, we're honored to have Dr. Jonas Nordquist here with us from Karolinska Institute, Sweden, who is the scientific chair of this program. And before talking about other presenters and other speakers, as it's the March 8th and it's the International Women's Day, I should say congratulations on this date, as we have two of my friends are here to present. And so first, we will have Hanane with us. She will talk about the general aspects and the general topic of learning environment from the based on AMI guidelines and other references. Then we will have a video clip for you, which will be an interesting one. Designed about opinion of different students in TUMS about learning environment in COVID pandemic area. And after that, we will have Mahla with us. She's going to talk about her experiences and the situation she had as a medical student in the School of Medicine. Unfortunately, Moin can't be with us today. Moin Hossein Alipur, he had some emergency problems, and we can't have him today with us. And after that, we'll have Dr. Randhawa, Gurchetan Randhawa, who is a resident of internal medicine, and he's going to talk about the COVID-19 situation and learning in that situation as a frontier in the COVID-19 hospitals. And after that, we'll have a QA part, and we want you as our audience, if you have any similar experiences that you want to share with us, to talk about it. And at last, we will have Dr. Jonas Nordquist with us, who will gonna summarize the session, and we will finish the session after that. Okay, I think we can start. Dear Hanane, can you please join and open your webcam. Okay, great. So the floor is yours, and we're all ears.
Thank you. In the name of God, the compassionate, the merciful. Hello, everyone. I'm Randhawa Shaban, nurse student at Tehran University of Medical Sciences, and I'm really pleased for being part of the panel. If my voice is okay, I'm going to get started. Okay. Do you have my screen?
Yes, we have yours, Hannah. Go on.
Thank you. Okay. Today I'm going to talk about the basics of learning environment in brief. Let me start. What comes to our mind after hearing the phrase learning environment is usually what you see in this picture: a blackboard, chalk, desk, a lecture room, and so on. But is it really the definition of learning environment? To answer this question, we have to ask another question. What is learning space? Here by space, we mean all virtual and physical learning spaces. As you see here, equipments, furniture, the room, Wi-Fi, and IT equipment, and so on. So we can say that learning space is a subcategory of learning environment. So what is learning environment? Learning environment has some official definitions that is here. According to American Medical Association, learning environment is the learner, all the stakeholders related to the learners, the settings, purpose of learning, and all administrative logistics related to learning. The other definition says that educational environment is all factors with which learners interact to develop effective professional attributes and good medical practices. The third one seems really interesting to me. It says that educational environment means a combination of climate, culture, ethos in which learning occurs. So let me explain a bit more. You know, we as students receive a great variety of messages unawarely from our environment, from faculty member as a role model, from our classmates, the patient, the incident in the hospital, and so on. And even from the policies of our institution. So we learn something we were not intended to learn as it was supposed in the formal curriculum or the intended curriculum. This is what we call hidden curriculum. It can be either positive or negative, but inevitable. So to put it in a nutshell, we can say that a learning environment exists wherever and whenever students gather, from the amphitheater to conversation over late night coffee. So you see that how wide is the range of learning environments. Let me talk about the features of a good learning environment. As you see here, to be most effective, learning must be undertaken in an environment that emphasizes a spirit of inquiry. It is supportive and understanding of students' needs and aspirations, and is characterized by civility and sensitivity to cultural, ethnic, and gender issues as they relate to students, teachers, colleagues, and in the clinical setting, patients and their families. So after getting familiar with the definition, we are going to talk about the factors influencing educational environment. As you see in this chart, there are some factors such as characteristics of learners, which is learning speed, cultural background, and so on. The other is assessment strategies, content. The content should be creative and also it should be relevant to educational needs, and instructional environment, administrative logistics, and so on. is a question that we as students, can we play a role in maximizing educational environment? The answer is yes. Anything we do to increase the motivation of learning in students can maximize educational environment. You see, there are three factors that can affect maximizing educational environment. Physical factors, which is about, the physical spaces we talked before, such as the temperature, comfortable seats, and so on. The emotional factors, it's related to student support systems and so on. We should feel comfortable in our learning environments. The other is external motivators that we are going to discuss later. Now I'm going to talk about the importance of learning environment. Studies show that students who are satisfied with their learning environment show a higher academic performance and reduced stress. Also, they express that they have enhanced academic self-concept via appropriate educational environment. You know what is academic self-concept. It is how a student visualize his or her academic ability. So, last but not the least, I want to talk about the changes in learning environments over years. Our traditional educational environment provided only surface learning, which resulted in retention of knowledge only. So the result was some students with theoretical knowledge, but they were incompetent. After that, there came an era of constructivist educational environments. It comprised of active learning, discovery learning, and knowledge building. In this era, teachers act as facilitators, and they facilitate the process of learning for the learners. So here is a point that before COVID era, we were familiar with e-learning or distance learning, but COVID has fostered the culture of distance learning and e-learning, and now it's the dominant way that we study and learn. As you see here in the bottom of the slide, the traditional classes has completely changed to distance learning. So thank you all for your kind attention. I'm done with the lecture. I hope that you all enjoyed it.
Thanks a lot, dear Hanane. So let's watch this video that our friends in TUMS made this about students' opinions on learning environment in COVID era. Let me share my screen. Dear Hanane, is it possible for you for stopping your share screen?
Sorry, I will do it now.
Okay. So let me see that everything is okay, and please tell me that the video has voice or not. Let me mute.
There's no voice, so I presume that you need to click or tick the box, share sound from the computer when you go to share screen.
Oh, thank you, Dr. Nordquist.
My pleasure. I've done that 1,522 times.
In fact, what comes to my mind is an image, not a word. A teacher stands in front of a blackboard with white chalk.
The first word that comes to my mind is classrooms.
When I think about learning environment, it reminds me of purpose. I believe as you are designing a pathway for your learners to reach a goal, you should also pay attention to your learning environment because it's the best way to indirectly lead your learners to the purpose you have imagined.
I prefer a house or a place like a home.
And if I could choose anywhere that my class is taking place, I would choose actual lecture rooms in universities because for COVID condition and lockdown and all that stuff, we haven't learned even more subjects in classrooms in university.
If I wanted to choose an environment for my class, I would try to choose the exact place it's applied, because I believe that information is infinite, but the learner should be able to distinguish between the most practical knowledge and the non-practical details, and it helps him to put most of his effort on the practical ones.
Okay, hope you enjoyed this video that was made by our friends. So next we will have Mahla with us. She had some technical problems. Is it okay for you, dear? Can you start? It seems that she has some technical problem. We'll trying to make it better. Okay, dear. Go on.
Hello, I hope you're all fine and have had a good time till now. I'm sorry for being late. I had some problems. I'm going to share my screen and start. Okay, I hope you have my slides. Is it okay? Thank you. I'm Mahla Rasimi, and I'm going to talk about the learning environment in Iran medical universities as a student perspective. As it was mentioned, learning environment is simply everything which is happening in the classroom and in a university. I mean, it refers to the physical locations, the culture of the university, and the relationships which students are experiencing, the formal curriculum as well as the informal curriculum. It has been shown that the learning environment positively correlates with the students' academic success and their satisfaction. I mean, it's widely agreed that the academic and clinical environment are important influences on the attitude, on the skills and knowledge and the behavior of the medical students. On the other hand, the students' perceptions of their learning environment affects their learning style and their learning strategies. and their outcomes. So it's important, and it's obvious that the medical students' learning directly affects their patients' health and their safety. So let's see what the students think about learning environment in Iran. Most of the students have a good perception of the teaching and learning strategies. I mean, although most of our teaching strategies now are teacher centered, but we can see that now we are moving towards more student centered and problem based strategies, which are really pleasant for the students. Also, we have well-focused classrooms with the appropriate use of time and a relaxed atmosphere for the students to learn. About our course timetables, usually our courses are well timetabled, but I'm afraid about our curriculum. It seems to be somehow overwhelmed with the lessons, especially in the preclinical years of the curriculum. About our teachers, most of the students say that we have very knowledgeable and well-prepared teachers. I can say that some of our teachers are not only, some of our professors not only a good teacher, but also they are excellent role models, which is a really important point in the hidden curriculum. About giving and seeking feedback, I'm afraid we should pay somehow more attention to it. Because we all know that how important feedback is in the students' learning, but we can see that it doesn't get that much appropriate attention. I mean, not only our professors, but also our students even don't know the importance of seeking feedback, so we can talk about it more and pay attention to it, to not let this important get missed in the crowd. About our communications, we as students have communications with our peers, our seniors, our juniors, and our professors, which I can say that all of these communications are very good and really educating. I mean, most of the students, many benefiting, most of the students have made good friendships for themselves. I mean, they have made a small but a powerful and supportive community for themselves. About student-teacher communications, it's the same. They are very formal and good communications. Which these communications, I have heard from my friends about these communications that are really educating. I mean, they have learned a lot from a single informal talk with a professor or a formal relationship with him. Because it probes, these kind of communications probes the students to learn some competencies and some skills. As a total, I can say that despite there are many some problems and stresses which we all may have, but students in Iran learning environments have a good social life for themselves. But I'm afraid these kind of communities and the support which students get from their friendships and their communications is not enough. I mean, we need a systematic student support in our learning environment. Because students get tired during their studies, they get exhausted in the clinical environments, and they need motivation, they need help, and sometimes they need advice to solve their problems, not only their study and educational problems, but also their other problems which they are facing in their life. We should consider that there can be many things which are stressing for the students. Many things can affect their coping, their personality type, their gender, their socioeconomic situation, or their emotional intelligence. However, the college environment is not the only source of stress for students, but the whole stress which students is coping directly impacts on her studying and educational experience. So we should consider it as an important point, and we should support them. We should help them to control their stress, and to make them, we should make them more positive and more in control of their education, so they can experience enriched learning experience. About the atmosphere, I can say that we feel comfortable at our classes. We feel safe to ask our questions or to be active in the class, especially in the classes which the professor knows the importance of an interactive session. Also, this atmosphere gives us the opportunities to develop the different skills which we need in our professional life. As I mentioned, when we have good relationships in the learning environment, so we can say that the students are learning interpersonal skills and communication skills. Also, in the case of having a good role model, we can say that the students learn the empathy skills, the problem-solving skills, or the skill for having a good communication with their patients. Totally, I can say that most of the students, most of my friends, say that this atmosphere makes them more confident of themselves, and it makes them concentrate more on their education. So it helps them to have a meaningful learning experience. But it is not all, I'm afraid, because as you know, it has been about 2 years that the universities have started e-learning for almost all of their educational programs, and it happened in our university too. But educational environment is in e-learning has many differences, because there are many challenges which we don't have in other types of learning. For example, about teaching and learning, we have less opportunities to learn those meta skills which I mentioned in e-learning. Or about the communications, we have less opportunity to communicate. Virtual communications have lessened our relationships with our friends, our peers, and professors. On the other hand, the virtual communication needs a different skill which many students may not have. And about feedback, which is I think an important problem, because we are getting less and less feedback in e-learning and virtual learning. We always have the material, we always have an online teaching session, we have the assignment, but there is no feedback, which makes the learning not be completed. These are some challenges. And also about ethics, those copyright problems and issues which we have, and students feel less safe in e-learning environment, because they are not comfortable maybe to ask their questions in virtual learning, and also to comment a sentence in the chat box. So we can see that in the online teaching and learning environment, we need more support, we need more help to be motivated, and we need to help the students to cope with all those stresses which they are coping in this situation. As you know, DREAM is one of the most reliable questionnaires to evaluate and improve the learning environment. I'm going to use it to sum up my words. According to the study which has done in one of the Iran medical universities, the students' perceptions are good of their learning, of their teachers, and also of the atmosphere. I mean, these three domains can be considered as good, but I'm afraid the students' academic self-perceptions and students' social self-perceptions have got lower scores. The increased stress and tiredness, and besides the lack of support system, are shown to be the most significant problems in Iran learning environment. I think it's worth mentioning that in this study, the scores are reduced in the senior years. I mean, the senior students are coping with a more stressful situation, and they have less perceptions of their learning environments. So they may need more support and more help in their learning experience. Thank you for your attention. I hope that my slides was good. Thank you. I'm done with my lecture.
Thanks a lot, dear Mahla. It was very informative, and also you mentioned beneficial points. So next, we will have Dr. Randhawa with us. Dr. Randhawa, we are all ears. The floor is yours.
Okay, good morning, everyone. Can you all hear me?
Yes, your voice is clear.
Okay, great. So I'm calling from New York City in Brooklyn, and I'm a colleague of Dr. Coker as well, and wanted to thank everyone for inviting me to participate today. So this topic of COVID-19 and residency is a very difficult topic for me to speak about. As you know, New York City at one point was one of the hardest hit regions in the entire world. And being a resident physician, of course, you are in training, but you also have to balance your education with service. And we unfortunately witnessed a lot of death at our hospital. At one point, we were responsible for about 2% of all the deaths within the United States itself at my one hospital. So as you can imagine, COVID-19 has tremendously impacted our training and education. And first, I wanted to kind of familiarize everyone with the educational system in the United States, if you're unfamiliar. So in order to practice in the United States, you first have to attend medical school, of course, and you have to pass your USMLE step 1, 2, and eventually step 3. And once you complete those exams, you apply for residency training in a competitive environment, and you participate through the match. And after the match, you basically go through your desired field of training. For me, it's internal medicine. So internal medicine itself is a 3-year program. And then afterwards, you go on to fellowship if you choose, or you could become a general internist or a hospitalist, is what we call them here in the United States. So for me, my career path is infectious disease, and I'll be starting this summer at NYU Grossman School of Medicine in Manhattan. So you can imagine COVID-19 and my career choice of infectious disease had a tremendous impact on my decision to go into this field and my training. So I guess to begin, I would like to just start by maybe talking about the typical educational environment, residency training, and how COVID-19 impacted that. So for residency training, part of it is classroom instruction. So we have morning report, which consists of residents going over an interesting case and some teaching with regards to the case itself. And then the residents themselves, as well as medical students, they try to come up with the differential diagnoses to see what the patient had and what the treatment would be. And then the residents would kind of go over the case. We also have noon conference as well, which takes place in our auditorium pretty much every day. So that's where one of the residents or one of the faculty members will go over a topic in a structured environment, and then have time to go over for questions and answers. And then, of course, as you're well aware in the clinical sciences, a lot of teaching also occurs on the wards at the bedside. So you can imagine when COVID-19 first came, we weren't really sure what to expect with the virus. You know, there was talk that it wouldn't be that bad, that it wouldn't be worse than the flu. And then, of course, as you can imagine, it was almost like a tidal wave hit our hospital. So we started with a few patients, and then within a couple of weeks, our entire hospital was dedicated towards the care of this one specific disease. And it got to the point where we had lost so many residents in internal medicine from the virus that we actually had to recruit every single physician in the hospital, whether they were a psychiatrist, a radiology resident or attending, a surgeon, you name it, they all had to come and join and help us. And it was very special because my seniors, because COVID first came when I was in my intern year, which is your first year of training. And my seniors had to essentially train and educate psychiatry doctors and people that have nothing to do with internal medicine on how to manage ventilators, how to treat septic shock, how to do procedures such as central venous line catheters. And it was kind of a unprecedented type of learning environment. And all those activities that I had mentioned to you earlier, whether it's the noon conference, a morning report, all those unfortunately had to be canceled at the beginning because if you remember, I had mentioned earlier, residency training is a blend of service towards your patients as well as your own learning. And it entirely got shifted towards service of the patients because there was an emergency situation and there wasn't really time to, unfortunately, go over those topics. And that was towards our detriment. And as people have mentioned already today in their excellent lectures, a lot of learning, takes place in person, which is what we're used to, before the virus started. And as things started to calm down, they shifted more towards e-learning. And I do feel like that has taken a toll on our training. We also didn't have medical students as well because it was too dangerous for them to go into the hospital. And I also feel like that was also a detriment towards our learning because when you have students there, they're only there to learn. And for me, as now a third year, it's one of my favorite parts of residencies is the teaching, learning, and mentorship of the students. And when you don't have those students there that are dedicated towards learning, there's less education that takes place and everybody's focused more on patient care and the work. And that also hurts everybody. So you can imagine COVID-19 has tremendously impacted residency training here in the United States. And it also impacted our clinical training in the sense that for that 1 year or so, all we treated was one single disease. So we didn't really get exposure towards all the other different illnesses that affect the body because we simply had to take care of this surge of patients. So now I would say that the virus has started to calm down a bit in New York City, and we're starting to do more in-person learning. We do have our students back now, which is great. We also still do a little bit of e-learning as well, but we're trying to basically put that kind of behind us and try to focus more on getting back to the way things used to be. The other thing that I wanted to mention that really impacted my training was our chairman of medicine was Dr. Kamholz. He was an outstanding educator. He was one of the most well-known doctors in the New York City area in the field of pulmonary and critical care. And he was one of the most brilliant educators that I knew. And even during the COVID-19 surge, he always continued to try to teach us whenever he could, despite all of his responsibilities. And we used to have these chairman rounds where we would go over cases and he would teach us everything about the patient's presentation. And unfortunately, he contracted COVID-19 and gave his life towards protecting the city. So that was also a tremendous loss for our hospital, and specifically my department, because he was the chairman of my field. And those were big, very big shoes that needed to be filled. And I still feel like his presence is missed, and all those things really impacted my training. And I wanted to give some time at the end, or for anybody to ask questions, because I'm sure there's many of you that might be interested in training in the United States or wanting to learn more. And I'd shared my editorial with Ali, so thank you to those that read it, and I'm happy to answer any questions about it. Thank you.
Dear Gurchetan, we don't have your voice anymore.
Here, go ahead. Can you hear me now?
Yeah.
Yeah, sure.
Okay.
Yeah, so if anybody has any questions, feel free to ask. Otherwise, that's basically what I wanted to go over in terms of being a resident doctor in New York City and how it impacted my training.
Thanks a lot, Dr. Gurchetan. It was very good, and we're so sorry about your professor who passed.
Thank you.
Okay, next we will have Dr. Nordquist with us. Any points that you want to mention, summarizing, sharing your experiences, and after that we will have Q&A, any questions in comments, or anyone who likes can after that open their voice and ask their question.
Well, thank you very much. First of all, allow me to congratulate the three absolutely fabulous speakers. And I'm so impressed. I'm writing here on my other computer what's been said here and what's been addressed this particular afternoon. And I think that if you were to look into the literature, you will see that quite a lot of what the literature discusses has been addressed at this point this afternoon in various portions. Allow me to begin with fabulous Hannah. Hannah, from the nursing schools, congratulations, an excellent presentation and lecture. You are taking off with the concept of learning environments and learning spaces as a subcategory of learning environments. You look into learning environments and try to understand this from the perspective of formal learning and informal learning. And you are quite interested in what impacts and what influences students' experience from the perspective of a learning environment. And in particular, you're addressing the motivational factors, and you look into physical, emotional, and external motivators. And clearly, you're spot on. The physical factors are quite important. Environment control in terms of lighting, sometimes really overlooked. Sound control. You look into the comfort of the seats, etc. And all these will be absolutely strong distractors unless they are addressed properly. So I think that you're absolutely spot on. I entirely agree with you about the emotional factors, how the environment is not just there to be functional in terms of, sitting and taking notes or sitting, listening and discussing, but also the emotional side of it. And if you think about many of the supermarkets or any of the fancy shops or the airports that you may or may not have been to, they are not just functional spaces. To a very high degree, they are emotional spaces, and they want to put you into the shoes of buying something or feeling very special if you walk into a hotel or anything like that. And I entirely agree with you that when you walk into a nursing school or a medical school, the emotional aspects here are very important. And, if you sit in a classroom and find it ugly and gray and dull, that does indeed impact sort of the overall experience and your motivation to study. So I think that you are absolutely making a very important point here. We then went to the medical school, and Mala, and she went into the whole idea about students' perceptions on the learning environment and a little bit about the clinical learning environment. And you are walking sort of into the classroom and think about not only the classroom, but what happens in the classroom and what type of teaching and learning activities do we have in the classroom. And you speak about teacher-centeredness versus student or learner-centeredness, and how would that impact the design of the various classrooms? And clearly, this is the whole issue about learning environments and alignment with curriculum, which is absolutely central to the conversation today. Role modeling. We also hear that here in the last remarks from Gurshatan, and you already started off the conversation about informal learning and role models and faculty members as being role models, and you can clearly see them on stage, but the level of informal conversation and the kind of interaction you have people off stage or backstage are sometimes extremely powerful and might really, really shape you for the rest of your career sometimes when you have that particular conversations. And again, I mean, this is a very important aspect to consider when you think about where are those informal spaces in conjunction to the formal teaching spaces where you can allow that conversation to happen between faculty members and students. In the hospital world, we do know that corridors are typical spaces where you travel back and forth between various locations. These are extremely important for sort of serendipity, where you run into someone and in the moment there may be a very short and unplanned conversation, but that one might be super, super, super important for you as a learner. Hallways, elevators, water coolers, coffee machines here in Europe would be other places where these type of events may actually occur. Wow, Mala, look, you are addressing the topic about feedback and the thirst. You're really thirsty to get feedback. And from your point of view, what happens in the virtual world is that feedback doesn't happen as frequently as it may have done in the real world. And clearly, feedback is extremely important from a learning perspective. And the question, I guess, is that how can we accommodate for that to happen, both here in the digital space, but also when you design actually a physical space? And it's really the $100,000 question. What is feedback? How do you design feedback? How do I know that I get feedback? And how do you know I receive feedback when you think you're sending it? So this is a constantly ongoing conversation. And the question here is, how would space actually accommodate for this, virtual as well as physical? Friendship is another topic that was addressed here by Mala. And it's not only the informal conversation with faculty members, it's also the friendship bands that you are creating when you are in school, and how the social clubs and how sort of social spaces here are very important to foster that sort of comradeship that you can, in the best of the worlds, nurture when you're in med school or nursing school, and how that might impact the rest of your life. And you meet people at the university that you stay in touch with many years later. Dream clearly is one of the most used at this point in time questionnaires or inventories when you look into learning environments, and it's brilliant that it has been also used in Iran today to see how perception here in various domains can be measured. And unfortunately, as we can hear now, the academic self-perception as well as the self-perception in general seems to be a little bit in decline, which is quite sad. And I think that there are many factors that do impact that at this point in time, clearly. Then back to New York, to our distinguished colleague here in New York, an excellent address as well, the third excellent address, and congratulations to you all. I have to underline that. And here we had the third-year resident, Gurshatan, sharing his experience of being in the front lines during COVID-19. And it's a very sad story, and it's a very touching story to hear how education ceased in a formal way to exist, and you went right into service. And many colleagues, unfortunately, contracted the disease in the early days, and as we heard here, are not with us any longer. And I think it's important to take into account what Gurshatan actually mentioned here, because I do think retrospectively that what we have seen during the pandemic is that many residents have learned tremendously amount of new things that they would never ever have experienced, of course, unless the pandemic. But what's very special here is that at the front end, you are under-supervised. You are on your own. And it's a disease that no one knows anything about in the early days. And you have to do your very best based on the knowledge you have. But you have to work on the edge of what you know. And there's no safety net. There are no supervisors because they don't know anything either. And they are also completely occupied with patient service. So I think that we always know that the clinical learning environment has pockets where you do perform clinical services above your level of competence and being under-supervised. And when it works, you learn quite a lot, but certainly you do put patient safety at risk. And in this case, not only patient safety, but also your own health and well-being. What I think is interesting here to listen to what Gurshatan says is that teaching, when you teach junior doctors on the wards, how important that is for your own learning. And the question here is how the physical environment may create those pockets that we heard here that Mala was actually mentioning the informal aspects of teaching and learning, and I guess that Gurshatan would also say that these informal conversations outside the actual spaces where you have patient beds might be extremely important when you both teach, but also when you learn medicine in a clinical learning environment. What I just like to share with you is I think that all of this is spot on what we tend to see. And clearly, during the pandemic, we all moved in to this space, the digital space, unless you were at the front end. And what I do in my day job is that I am the Associate Residency Director at the Karolinska University Hospital. That means in the American terms, I'm the DIO, which is the Designated Institutional Officer. That is the top commander at the hospital level. And under me are 43 different residency programs at Karolinska and about 700 residents. So I think I quite agree with all what's been said here from our colleague in New York, but also what I heard from the nursing school lady and the lady from the medical school, because next to our hospital is Karolinska Institutet, where we have all those particular programs. So my final remarks would be that what about then, to connect back to the first excellent talk, what about the emotional aspects of the clinical learning environment? No, not the clinical, of the digital learning environment. Emotionally, we heard about emotional safety. We heard about being afraid of asking questions, being afraid of even switching the camera on in a space like this. What can be done to make this particular space where we are now emotionally inviting and emotionally safe? And what I have started to do is started to play with Zoom together with my colleagues from BBC and together with my production team to make it more inviting. When we logged on here today, we saw just empty boxes, black boxes, and we always see that when we log into Zoom, don't we? But what happened when you log in, you are met by a holding slide or a video, a watch that counts down, maybe some music, and welcome to today's event. This is the topic. This is what we're going to discuss. We will start in, and the clock is ticking down to the number of minutes that remains. And then when it starts like a TV program almost, and you might have some music, and then the host comes in vision. And from there, you actually produce it, as it were, like a live broadcast. Would that enhance the experience? Would that increase sort of level of emotional safety that we heard here being addressed in two of the ladies when they discussed it from various perspectives? So I think that what you have done today, the three fabulous speakers and the wonderful produced video, I have to say, is that you have, from various angles and from various perspectives, touched on very, very central and core issues in the global conversation today about clinical learning environments and environments in medical schools, virtual, physical, and indeed at the production and in the service lines where people are taking care of patients. So I think I will stop here to open up for questions and comments, and I certainly remain for the entire session. And I should say that I'm super delighted to be re-invited. I love working with you, and I love to participate in these particular seminars. So thank you for providing me with this tremendous honor. Thank you.
It's our pleasure, Dr. Nordquist, to have international friends and guests like you and Dr. Gurchetan. So let's move on to the Q&A. We have Dr. Gurchetan here with us, Dr. Nordquist, and also we have Dr. Kakur with us and some of our professors in the med-ed field in this session too, so you can ask each of them that you like. Dr. Kakur asked the question, I'm going to read it from the chat box. From all the things that we learned and all the adjustments we made during COVID about the learning environment, what should we keep for the future?
I can begin. I think, from my own experience, you may disagree with me, so please feel to do so. But sometimes I think people are, and particularly faculty members here at Karolinska, are a little bit too nostalgic. They speak about the pre-COVID days in a very romantic fashion. And look, I'm 51 this year, and I spent all my life in higher education. And I've seen tremendously dull, boring, gray classes, IRL. And I've seen splendid classes in Zoom. I think that the breakout functions and sort of the kind of interactivity you can get on Zoom should not be just dismissed. I think that there are some excellent examples of how Zoom can actually be used, and also how we can reach people far outside our small circles that we normally have. So I think that IRL teaching clearly is here, but to me, digital teaching and learning in the hospital, but also at the medical school and the nursing school, is here to stay, of course, and it should not be considered a second class to IRL classroom teaching. I don't think so, but I do think that we should think about, as the ladies addressed here today, think about the emotional aspects of how that can improve in Zoom. So that would be my comment.
That's great. Dr. Kakur, if you like, you can open your webcam and we can have you with us too, so we can learn from your experiences too. And also, Dr. Gurchetan, any comments that you want to mention about her question?
Yes, no, I thought Dr. Nordquist brought up excellent points. I definitely agree that there have been many dull lectures in my life. And I just think that Zoom is something new. And I think it will improve in time. And I do agree that it brings new tremendous opportunities. For example, we have colleagues in Europe, myself, Dr. Coker in New York City, all of you in Iran, and none of this would be possible without this platform. So I do think that the world has changed, and it's up to the educators, the students, and everyone to kind of take this opportunity and see what we can do to improve our education with this new technology and environment.
Dr. Gurchetan, if I just may make a comment on what you just said, I think you are absolutely smashing it. The problem is with Zoom, or well, when we first got TV and actually the moving video or the film was invented, the way people was considering filming or movies was to record what you did on the stage of a theater. Today, no one really thinks that movies are just recording what happens on a theater stage. Movies are something different when you actually produce them. And I think what happens now is that we need to start to teach and treat Zoom as it is Zoom. And Zoom is not. You cannot copy and paste what you do in the real world on Zoom, because Zoom is a new entity. It's not filming what's done on the theater and then broadcast it as it was a movie. You have to consider Zoom as it was a movie, and that's a completely different type of production compared to what you do IRL.
Yes, no, for example, because of the COVID-19 pandemic, all the medical students that are applying for residency and the residents themselves that are applying for fellowship, everything has actually been on Zoom. So you can imagine when I was in medical school and applying for residency, I was traveling throughout the entire United States, all across the country to these different hospitals. And one of the things I wanted to mention about that is, yes, it was certainly nice to be able to see the hospital, the environment, and to meet the people in person. And I was a bit apprehensive about what to expect when I applied for my infectious diseases fellowship, but I do feel like I still got a very good chance to see the colleagues I would be interacting with in the future. And while it would have been great to have seen the actual hospital, I don't feel like it was necessary towards my detriment. And the other thing I wanted to mention is cost as well. It's very expensive to travel in the United States, and it's very hard also to attend all your interviews that you might have basically offers for. So I would say Zoom has actually been really good for us in residency because we don't get paid that much, of course, in training. So you do save money that way, and it's very easy for you to cast a wide net and to interview at many places that you otherwise might not have been able to do. So I do think there are some very good things, and that was one thing that I was a bit apprehensive about again, and I thought, it was something great for me, and that's something I do feel like will last in the future as well. So for you that are interested in training in the United States, I would expect that you would do interviews on Zoom again in the future.
I would be very interested to learn what Mahala thinks about and what Hannah thinks about these things.
Thank you, Professor, but I have no comment about this. I was just listening and learning from you.
Thank you.
Thank
What about
you.
Hannah? What about
Thank
Hannah?
you. Thank you, Dr. Nordquist and Dr. Gurchatan. It was great. I was listening and they were really useful. Thank you.
Well, when you think about your questions, I think that Gurchatan, you're mentioning a very important point, and I have to share a story with you. When the pandemic first started, and I am the co-chair of the International Conference of Residency Training, and we normally meet in Canada every year. But the very first conference, of course, during the pandemic was virtual, as well as the second year. But at the first conference, everyone was sort of nervous, you know, everyone got, like we do now, connect to the Zoom, and all of a sudden a chap popped up and we couldn't hear him properly. So I was saying to them, look, maybe you should reconnect. Is the problem with your Wi-Fi connection? And all of a sudden he switched his microphone on and said, no, don't worry, I'm on a bus in Kigali. I'm just about to disembark the bus. So here we had a resident in Kigali in Rwanda who could attend our global conference. That would never ever have happened unless we had pandemic. And we do see lots of people in Africa and other parts of the world that would never ever have the funds traveling that now can join by their cell phones to various international conferences. And I think that's a huge step forward.
Okay, I see Professor Kakor here. You're muted, I guess.
Mute. Yes, I feel exactly the same. There are so many new opportunities that have come out of this terrible tragedy for so many people and for all of us. And I see really the future as blended. Obviously, there is a place for in-person learning, in-person engagement, and so on. But there's also a place for virtual learning and virtual encounters and virtual conferences. So I think the future will be blended, and we need to figure out how we can merge these two different formats to make it most optimal for everyone.
Okay, so we have another comment on the chat box. Optin asked, thank you for a splendid lecture and talks. What's your opinion about developing more consistent standards for educational environments and further mentoring them in the curriculum? In other words, is it necessary to go beyond subjective ideas about educational environments? Any of our professors and doctors who want to start?
Gurchatan, what's your thoughts?
So I think this would be great in terms of feedback, because as the other students had mentioned, feedback is something that's lacking, even in my level of training residency as well. So I think if we have some consistent standards, it would make the feedback a little bit more uniform and less subjective. And I think that would be able to help the residents and medical students that are in training. And not only to give feedback in the sense of, you know, you did a great job, but to give actual structured, you know, feedback, like your presentations were excellent, your medical knowledge was great, your physical exam, etc. All those things I think are something that could be more uniform and standard, and I think that would help the people in training.
I think that in the whole notion where we are now, or here, the whole paradigm is moving towards competency-based medical education. And we see that all over the world. What happens is that in the old days, when we did not have a formal curriculum in particularly clinical training, the clinic became the curriculum. the kind of patients we had at the clinic and the kind of faculty we had at the clinic. And what happens if there's no standard is that I become the standard. I am the point of reference, and my knowledge is the subjective perhaps, but it's still the frame of reference, and I am the standard, and I am judging you, and I'm examining you, assessing you against my standard. And maybe that works if you are in an environment where you have high and excellent standards of faculty members, but still the kind of patients you will have would still be your local patients. And if you train to work in that particular clinical environment for the rest of your life, maybe the training then is going to be rather suitable there for that local context. But as we heard here, Gurjitan is actually mentioning that in the US in particular, you move between various institutions. So you might be training as an intern in one, and then you match, and then you go to another institution. And once you pass your board exams in that institution, you might move to another one. And an orthopedic surgeon needs to be an orthopedic surgeon. Doesn't matter if you are trained in Shiraz or in Tehran, still an orthopedic surgeon might need to meet the same standards. So clearly in the era of competency-based medical education, the actual curriculum establishes these standards, and standards are broken down into milestones, and milestones will have different steps in terms of progression. So that goes into the curriculum as such. But to make that work, the assessment in the physical space is very important clinically. And also the feedback that you receive on how well you perform against that particular standard. So the question then becomes both, how do we train faculty members to provide feedback that is not just, well, good done, continue like that. It doesn't, well, it might be good and boost your self-confidence and self-esteem, but in particular, what was good with my performance and what can be done better, and how can you make that more constructive so you can actually learn from that particular experience? It's very important when it comes to feedback. When it comes then to the learning environment, the question is, where are those places in the hospital or in the nursing school or at the medical school where you can provide feedback, formal and informal feedback? So what I'm trying to say is connects curriculum, design, instructional methods, assessment methods, and physical spaces where those actually intersect. So this is a very complex issue, but I think that you need, as Mala was mentioning, teaching and learning strategies and where they meet and how they need to be properly aligned, which is a super important issue. And what we know is that the clinical learning environment, what happens here, actually impacts many, many years of your clinical service. One of the first studies that came out was ASH study back in obstetrics and gynecology back in 2009, where you actually can look into hospitals where you see services where you have high complication rates and services where you have low complication rates. And if you trained as a resident in a high complication rate service, you will, for the rest of your career, or for at least 14 years down the road, which at least half your career, continue to be a high complication rater, even if you move into low complication rate service. On the opposite, if you trained in a low complication service, you will continue to be a low complication rater, even if you move into high complication service. This has been replicated for prescription of drugs. It's been replicated for prescription of diagnostic testing, etc., etc. So clearly, what happens in the learning environment where the curriculum, the instruction, the assessment, and the physical space meets have an enormous impact for the rest of your career.
May I say one of my experiences about this and the appropriate feedback? One of the ones which I got was in the surgery rotation, and I had a suture on one of my patients, And our residence was there from the first I started my job till the end, and he was just paying attention, looking, and step by step he was just guiding me. Yeah, you're right, it's good, your hand movement is good, and like this. And also my wrong movements which I was doing, and it was a perfect experience for me. And as you mentioned, I'm going to remember this to the end where I go. That experience is in my mind.
That's an excellent example, and it's both technical but also emotional. And you stand there as correctional feedback in a way that, no, not left, a little bit careful, yeah, that's it. So you have both sort of the correctional as well as confirming, and it's really walking you step by step by step. So yes, that's a very good example.
Okay, we have a question from Dr. Kakur. Formative OSCEs are excellent opportunities to measure performance against standards and provide effective feedback. Are they done routinely in Iran? Yes, we have them.
So I have to say that there's something wrong with my voice, I think. Yes, we have some internal medical subjects that first we have the theoretical subjects, then we are going to hospitals, and the first session is the OSCE, and the last one actually which is the the test. Actually, I don't know how to say it. That's an exam. It is in OSCEs.
So it's actually, the OSCEs is actually a test where you have various stations, you move around and you do small sort of clinical tasks, correct?
Yes, and also our time, the quality of care and the procedure, they are all examined by someone. It has some dimensions, not just one.
Well, that's excellent, because what you do here is you're not only looking into clinical skills, you're also looking into communication, teamwork, and all those what's called soft skills, which I don't think is the proper description, but it looks into these more general competencies as well, correct?
Yes, for sure. And sometimes we have someone who pretends that he or she is sick, and we have to do the nursing procedure completely.
And Moshitan would certainly recognize this in the US, looking to standardize patients and also looking in sometimes to different types of simulations, right, Moshitan? Do you agree on this, I presume?
Yes, I do. And in fact, Dr. Kapoor is one of the leads in our hospital in my department for organizing the OSCE. So we have that every year. This year we actually have it twice. And we used to have the step 2 clinical skills as well, which the exam no longer exists. But when I was in medical school, we had to pass that exam in order to go on to residency and become licensed.
May I? I think Professor Kahur asked about debriefing and feedback. Yes, we have. At the end of the stations, I mean, there are some stations during the OSCE exam, and we pass them. And at the end of the exam, we have that feedback receiving and debriefing of all the exam, and each station, as my friend Hanana mentioned, has appropriate time, and every, it's a kind of job examination. The relationship, the communication which we make with that patient and everything is assessed during the OSCE examining.
One thing I should add is that we have checklists. You know, before entering the OSCE test, we actually read the checklist, and we're going to perform the procedure due to our checklist. It really helps us, you know, in detail, we know what to do step by step.
And I think that's an excellent point, Hannah, because what we know is called the backwash effect. And what we know, you know, backwash, the wave comes back. Because what we know is that unless teaching and learning objectives are not clear to the students, what they will do is that they will look into all tests. And all tests and all exams would actually define what I'm expected to learn during this particular class or this particular rotation. And it's no secret what you should learn and be able to do once you finish with us. So the checklist really helps you to understand exactly the way you formulated it, what's expected, what you're expected to learn. The problem is that if you make it too detailed, sometimes you can't see the wood because all the trees. So how do you strike the balance between having it both detailed in a way so you would know what's expected, but not so detailed so you lose the entire perspective? But what checklist does is that it takes away also me as the standard, as the gold standard. It's out there, it's objectified in a checklist based on a curriculum that a group of people have set together. So it takes away the subjectivity of me at that particular point. At the same time, it directs your learning towards the final goal of that particular class. So I think it's a very good example, also the way you are describing it, Hannah.
Thank you.
Okay, actually, I had one question too from our professors here with us. It's not about OSCE, it's about the future of learning in the post-COVID era. It came in my mind in this morning, and I was just thinking that how would it be like, any thing that you think that is related to it? I don't know. It's a, you know, it's a general question. I want to know that if there is any guidelines for post-COVID and hybrid classes. How can we use both online and offline contents and related materials like Zoom, Skype, Google Meet, and these kind of things? And do we have any I don't know, training sessions for the tutors so they can provide hybrid classes? You know, as I know that there are different countries are in different situations with COVID-19, and we have this new variant Omicron, but in here in Iran, sometimes we go to the school, and when the daily cases are not that much high. And I was wondering if our professors and teachers can do hybrid classes, but I didn't have any idea what was done in other countries. Is it easy to have hybrid classes in medical classes? I don't know, you know, I just wanted to learn from you and listen about it.
Rajasthan, what are your thoughts?
So in the United States, I would say like in the public education, there has been hybrid, but the thought that I had is, you know, everybody in this meeting today, we're all scientists, we're all in science, and I think education is no different. And I think everything is new and it needs to be studied, you know, objectively with these different models and to have some type of uniform impact. And I think that would be kind of my thoughts is we have people that are dedicated their lives towards education, and if they study, you know, these new technologies and how they impacts it versus, you know, maybe a non-hybrid or traditional model, I think that would be something I would be very interested in seeing for the future.
I think from my perspective, I think that hybrid is a buzzword that everyone uses these days. And honestly, I think it's completely crap. Yes, crap, nonsense. Why do I think that? Not theoretically, because it wouldn't have been fabulous that people both can attend live, but and also virtually, and we do see that. But the reason why I think it's crap, well, it's crap, but why I think it's problematic is that when you have a group in a room and you have some people attending virtually, you need to have very good cameras in the room to capture people. And also when you facilitate the conversation, when you're in the room, how do you relate to the people that participate remotely? And I shouldn't say that it's all crap, because it's not. The other day I was on a session with the Shed Theater in New York and with the Kennedy Center in Washington, D.C. And we had a class of theater students at the Georgetown in Washington, D.C. And they were in a rehearsal room somewhere else. And some of us actually were participating online. And it worked out brilliantly. But it is difficult still, though, even if they manage to do that's quite good, and they in theater, so they used to do productions and think about it still. It's difficult when they speak in the room to capture the sound, so we also can become a part of the conversation. It is problematic if you don't have the technical setup in the room, particularly with sound, but also with cameras to make that happen. In terms of conference productions, it makes it extremely expensive, because both you need to have the venues as you used to have in the old days with all the catering and the size of the venues. At the same time, you need to have the production company to do the technical side of the conference for you. And that is very, very expensive if you want to do that professionally. So hybrid, yes, I mean, it sounds fabulous. And if it would be working, it's going to be fabulous. But as it looks now, it's we're still, should we say, maybe not crap, but certainly very, very early days, not to say Stone Age.
Dr. Kakur, you are muted. We don't have your voice. I guess you're muted.
Okay, now here we go. Sorry, I have to respond to that because I'm a big proponent of blended or hybrid, whatever word you want to use. But I think, you know, we have to think more creatively about it. The interactions may not just be with video, and yes, it's expensive, or although many people have figured out ways to use iPads, to use other, you know, low-cost technology to connect people. It's really about connecting people. And there are also other tools that can be used. For example, Poll Everywhere. You can be in the room and you can be outside the room looking at the streamed lecture and still connect with Poll Everywhere or other such types of apps. We need to just be creative and figure out new ways to do it. We can't measure it with old standards or old strategies. So I want to say it's not crap. Sorry about that, but I feel very emotional about that.
No, I mean, I entirely agree. I mean, I completely sympathize with your point. And I think that it doesn't need to be crap. But what you tend to see is that unless you are creative, unless you do what you said, it becomes sometimes, should we say, maybe not crap, but substandard.
Yes, yes. And I think we have a lot to learn there. I mean, there's a lot of room to explore, to do research, like Gergistan said. You know, there's a lot more to be done. There is, however, also a community of people who have done already a lot of research about e-learning and online learning. So I think they have not been fully utilized in terms of how we are moving forward. But I think there's definitely, it's not either or anymore. It shouldn't be either or anymore. And we should move towards a new way to enhance the learning environment for everyone. And I think teachers, faculty do need to adjust to the new world. And I think, you know, of course, COVID created a lot of shock, was a big shock for everyone, but there was a lot of resistance from many faculty to really take advantage of the new opportunities and learn new ways to teach. So sorry, I feel very passionate about that. But I think there is a good way moving forward.
No, I entirely agree, and I'm not pessimistic, but I think that, you know, you need to have the kind of mindset that you do have. And unfortunately, I haven't seen too many people at this point in time that actually have been so creative and forward-looking as I think that you are giving testimony to at this point.
Thanks a lot. It was really informative. So I think that we need more time for having hybrid classes in our pharmacy school or medicine school here in TUMS. One of our professors tried to do that, but unfortunately it was not that much good. I think he couldn't connect the ones who were in the class and who were online, and you know, it was just not that much good and interactive. Okay, any other questions from our other guests and audience here? We can wait for you, or you can open your mic and ask your question. Any other comments on each of the topics we talked? Okay, I think there's no more comments and questions, so we can have the memorial picture. So if it is possible for you, any of you opening your webcam so that we can have the picture. Ms. Nademi, is it possible for you to have the picture for us? So are we done with the pictures? I really don't know about this one. Okay, I think we're done with that, yeah. So we have Dr. Karbasi with us here. She has some microphone problems. Oh, it's okay.
Yes, thank you, Adi. Thank you, dear Adi, and thanks from all my students and teachers and professors and participants who have participated in our webinar as well. And I have many learned information about you, and thank you so much, and thanks for your accepting our invitation as well. And I hope this webinar could be able to continue as well in the post-COVID era, as Ali said. Thank you so much. And from a student engagement in medical education unit, I want to say many, many thanks. Many thanks for your consideration and kindness to have your information in this regard. Thank you, and I hope you are well, and hope you see you as well. Bye. See you.
Have a good night. Bye-bye.